Hello and welcome, Dr. Lipnitsky with Strive Physical Therapy. Today I'm continuing answering some of the questions we commonly get from you, and today we're going to be discussing a very common problem called Piriformis Syndrome. So why is it called syndrome? Well, syndrome is a combination of different symptoms related to a very specific body part. When it comes to piriformis, we are talking about a pain in a butt, literally. Some people call it a toothache in the butt. It hurts right in the middle of the buttocks, and it's most commonly associated with a physical activity. Now, where does it come from? Piriformis usually has two different etiologies. For some people, they get pain around the piriformis, and that's, once again, that's why it's a syndrome. It has multiple symptoms. And the pain around the piriformis very commonly associated either with a nerve irritation around the lower lumbar segments or a sacroiliac joint discomfort or hypermobility. When the sacroiliac joint is sprained, we often have pain radiating towards the area of the buttocks where the piriformis lives. Well, for other people, it's associated with very specific muscle pain. Now, where does the muscle pain come from? Well, for piriformis, in a case of piriformis, most commonly the muscle pain is associated with repetitive injury or instability problem around the pelvis, and the piriformis commonly becomes a compensatory muscle. Now, if you think of the pelvis, stability is very important for the pelvis because as we walk, we spend quite a bit of time on one leg. Now, think about it this way. If the main muscle that holds the pelvis in a very balanced position called glute medius, if this muscle is not firing, what's going to happen, we're going to sink in every time we make a step, and that sinking in affecting the piriformis, and the piriformis will be constantly clenching and going into spasm. Now, with time, and that's what we call repetitive injury syndrome, with time it develops either tendinitis or inflammation of the tendon of the muscle, or tendinosis, which is a formation of a scar tissue around the tendon from that repetitive wear and tear. Now, it also very commonly goes into spasm when we have an instability of the sacroiliac joint, the joint connecting the pelvis and the sacrum together. And a lot of people have this joint very unstable. Some due to muscle weakness, whether it's a core muscle or glute muscle. Remember, it has to create a sandwich in order for the pelvis to be stable. Now, if there's no sandwich, if the muscles of the abdomen are weak, and we often have that hypolordosis position, or if the muscles of the pelvis are weak, and every time we make a step, instead of the big gluteal muscle pulling our hip backwards, we use often other auxiliary muscles of lower back, for example, creating this movement. Now, we're getting a lot of piriformis involvement because piriformis is a muscle that helps to move that pelvis. Now, whether you have a primary problem with the discs or nerve impingement or sacroiliitis, or we have a secondary problem with a repetitive injury to the piriformis, the treatment will be quite different. With case number one, we're going to concentrate on reducing the inflammation of the spine, decompressing the discs, and allowing the vertebrae to come apart and free the nerve space. Now, that will calm down the nerve, and in case of the sacroiliitis, we're going to be working on reducing the inflammation of the sacroiliac joint and correcting its movement. Now, if it comes to a second problem, when it's more of a functional issue, when piriformis is repetitively injured due to the weakness and instability, we're going to concentrate on working on those tendinitis and tendinosis issues, reducing the inflammation of the tendon itself, and we have a variety of treatments for that, as well as reducing the scar tissue that's been building up as a repetitive process. And we're going to touch upon the certain treatments that you commonly ask for example, SHOCKWAVE. So I'm going to talk about it in a second, but so you understand, a second part of this is restabilizing, creating a stability of your muscles, of your pelvis and your core muscles, and you will be spending quite a bit of time retraining those muscles, both here in a facility as well as at home. Now, when it comes to those tendinosis and other issues related to scar tissue formation, whether around the insertion area of the piriformis at the hip or at the sacrum, yes, SHOCKWAVE is an amazing tool. Why? Because it blasts away the scar tissue. It destroys, disintegrates the scar tissue, restoring a proper mobility and flexibility of the soft tissue of your tendon, ligaments, and muscles. And by doing that, also revascularizes the area and rebuilds, on a cellular level, rebuilds the muscle tissue. So amazing tool, but by far not the only thing that needs to be done. As you understand, it's a combination of treatment, both from the diagnostic perspective as well as from the re-education perspective and treatment. So I hope I answered that question, and please, we'll love you asking questions. Join us, push that button, subscribe, and please email us, send us questions on Instagram or YouTube. We'll love answering them, and we'll be making more videos answering those questions.